it's Bonnie Southgate, hEDS Rehab here. I am bringing you a class today that I taught earlier in the day. It's very much a class on exploration of movement to begin with. We start the class sitting down, so for those of you who can't stand or lie down, this is a great one for you to try. And then we do lie down and we touch on sciatica and ways to help with that. So if you're somebody with sciatica, then hang on for that part of the class. And then we finish with some nice relaxation. So I hope you enjoy it and I will see you at the other end. So we will get started. So we're going to start sitting down today. I'll make sure I can get in your view. Back here. So first thing we're going to think about today is actually going to be a little bit of neck and posture, because cervical instability is not uncommon in those of us with HSD or EDS. And what I have found is that if you do have that instability there, and you may not even know because you might not have horrific symptoms, it can actually make the muscles not function as well as they should do down the chain. And so what I'm going to do is like a really simple test to begin with. And if you find that either of these little exercises impacts how you feel and what I ask you to do, then that's going to be homework for you, because I definitely have found in my clients that was important in progressing some of them. So we're going to think, first of all, about if you're sitting, take your hand to the side of your knee, and I want you to super gently, so to give you an idea of how gentle with some of these things that I want you to do, if you were going to like poke your eyeball, you would be pretty gentle. So I want you to think that, like when I ask you to do like a little bit of a muscle test, that it's the same degree of effort you would be if you were going to try and touch your eye. So I want you to take one hand, and it doesn't matter which leg, to the outside of the leg, and I want you to really super lightly push, and I want you to feel whether it feels a bit wobbly or it feels strong. So, and we're going to do this on both sides because it's going to be information for you anyway. So you're going to do one leg and then you're going to do the other leg. And it could be that the leg is wobbly or the shoulder is wobbly. And we're just looking at that. So now what I'm going to ask you to do is take one hand under your chin. And obviously, if you've got really lax fingers, it might be difficult. But what I want you to do is think about not clenching your teeth, keeping the jaw slightly open, but gently pushing the chin down and then retesting and seeing whether that feels stronger. So if it feels stronger to you, then it may be that what we're doing is using the neck flexors, which help to stabilize the neck. If it feels stronger and you can change hands, then you know really that this could be some homework for you. And for some people, it will make a difference, and for some people, it won't make any difference. And then the other one, and this may seem a crazy thing to do, is just to put your hand on top of your head, and then push your head up into your hand. So it's axial lengthening. It's actually taking that head up into your hand and then trying that as well. And then, so I'm pushing my hand into my leg, and then I'm going to try the other side. So for me, for example, putting my hand on top of my head definitely made a difference, more than anything. For some of you, it might make no difference. And for some of you, it might be one or the other. Sometimes it's both together. If you found that that did make a difference, one or the other, then we'll start with just doing a little bit of that now. And you can either, it's not going to hurt you to do it. If it makes you dizzy or woozy, obviously make sure you're sitting down so you're safe. And it may be that if you do have poor positioning with your neck and everything else, that it allows the blood flow and the things to flow. So you might initially feel a little bit dizzy doing it. And if it does really make you feel not great, then don't do it at all. But so we're just going to take both hands here. And I do this, like when I give this away as homework in my clinic, I'll often have people use something that's firm but very light. So it could be a really light, thin hardback book or something, if your hands are unstable. And you're going to think about your eye line being perfectly straightforward. And I want you, if you're slouching here, I want you to think about sitting tall. And you're going to very gently push down without clenching your teeth. And then you're going to relax. And just let yourself relax in between. And again, it's a very, you can just let your arms come into your body for support, and you're going to very gently push down. And relax. So we talk about core stability, that its cervical spine is part of the spine, and it's really important that we're stable up there, and gently push down. And relax. We'll do that a couple more times. And the effort is very light. I'm not doing a massive push down. So less is more for us because we don't have great proprioception. Gently pushing down. We tend to over-recruit muscles. Rather than under-recruit, we often over-recruit because we want to feel them. So make this super light. And one more time, gently push down. And relax. Now we're going to go for the one. Now, if you haven't got a clinic band, you can use your hands. I like to use a clinic band because I think it's easier, especially if I can't lift my arms, if you can't lift your arms over your head. That it's not very attractive, but it does the job. So you're just lightly, I'm not pulling it down, giving it tons of tension, and you can decide how much tension you want. And as I do this, I want my head straight forward, so I don't want to lift my chin and extend the back of my neck. I want to think that my head is really tall. And the idea is that I'm lifting my head up into the band without pulling your shoulders down. So watch that your shoulder blades aren't being dragged down, or your arms. Just feel like you're lifting your head up into the band. And then relax. Let everything relax in between. Have a little break. I think this is one that can get the blood flow going because it lengthens everything out. And again, you're going to lengthen up into the band. And relax. So if I turn sideways on, I'm careful not to do that. I want to lengthen up into my band. And almost feel like I'm separating the bones. And then relax. And again, we're going to lengthen up almost as though you're separating the bones. And relax. And one more time, lengthening up into the band. And relax. Just take the band and just place it either beside you or back on the floor. So I want you to think my neck feels a bit lighter for doing that, a little bit longer. So what we're going to think about is our actual shoulders now. So when we think about our shoulders, and a lot of us, I'm certainly somebody who's had lots of subluxations and dislocations, we often think it's just the arm in the socket, and it's not. So it's about what we call the shoulder girdle, and that is made up of your collarbones and your shoulder blades in back and your arms. And if those three things don't move together, then we have a problem. And seeing as we can move things independently quite easily, often that is the case with us. So we're going to think about the separate parts a little bit, and then you can identify if one of them is a little bit more difficult for you than the other to move. So we're going to start, take your other hand across your collarbone. So we're going to take a hand on the collarbone. So when we lift our arm, the collarbone, and if you make this motion with your hand, should be able to slightly rotate and lift. If I was to lift my arm, and I'm not saying to lift your arm yet, but that motion needs to be able to happen. Now, a lot of us get quite tight in the muscles in the front of our chest because we do everything in front of us. We wash our dishes, we drive, we hold things. It's all in the front of our bodies, and we tend to get quite tight through there. So we're going to just take that hand there. And I also want you to feel like whether your shoulder comes forward. So I know my right shoulder is more unstable in one direction than my left, and it tends to sit more forward. So I want you to take your hand there, and I want you to very gently take the shoulder that way into your hand, and you're going to block the motion a tiny bit. So this is what we call an MET, which is a muscle energy release technique for some of the muscles in the front of the shoulder. We're going to do that 3 times. And all you're going to do is super gently push forward. And then you're going to let it relax, and you're just going to leave it relax for a bit. So make sure you use a bit of the hand that you feel comfortable with. And we'll do that one more time. You're going to gently bring it forward. And relax. Right. And then we're going to shrug the shoulder up now. And I want you to think when you shrug your shoulder up that your collarbone lifts with your arm. So your arm doesn't lift independent of your collarbone. Your collarbone can come up and it can relax back down, and it can come up and it can relax back down. And one more time, the collarbone can come up and it can relax back down. And we're going to go to the other side and do the same thing. So you might feel that the collarbone or the shoulder sits differently on this side. It might sit back, it might sit forward. But we're going to start with the same thing. So we're going to very, very gently push that shoulder forward into our hand, into that I hope you can see that motion forward. Really lightly. Again, it's almost like if you were going to be pushing onto your eyeball. That's the only way I can describe it. So it's a light push, and then relax. Try not to over tense all the muscles on the arm that you're using a little bit for stabilizing. And again, push that shoulder forward. And then gently relax. And again, gently push forward. And relax. And now we're going to think about that collarbone on this side. And we're going to shrug up, thinking that the collarbone lifts up with the arm. And so I have not as much proprioception on this arm, so I really do have to think about it. I have to think that that bone needs to move, otherwise my arm wants to move without it and coming down. And again, and everybody may find that one side is more difficult than the other. On this side, as I lift my arm up, my shoulder wants to go forward. So I'm trying to make it come straight up and then relax. So the other thing with the arms and the shoulders that's really important is our shoulder blades in back. So I think when I learned about movement and anatomy, I was really shocked because I guess maybe I have a lack of proprioception from the hEDS, is that if this is your shoulder blade on this side, the socket for your arm is part of your shoulder blade. So if my arm moves and my shoulder blade doesn't move, then I'm separating my arm from my socket. So that was like a big light bulb moment for me, is that I can't move my arm without some response. You can move it to a certain degree, but after a certain degree, if you don't let that shoulder blade move with it, you're separating the arm from the socket. Normally, people's ligaments will take it with it. So we rely much more on our muscles to be coordinated everywhere in order for things to move well. And so it's a little bit trickier. So what I want you to do now is just maybe if you can sit back or be in a situation where you can feel your shoulder blades. Maybe they poke out and back or not. Maybe you can feel like you're holding tension in the back of them. I want you just to get a sort of sense of where those shoulder blades are. And I want you to try and just explore moving them around a bit. You know, if you don't have a chair that you have a back on now or somewhere to find that, I want you to go away today and think about what's going on with the shoulder blades in back. The shoulder blades in back very much interlink with the hips, particularly the opposite hip. So you'll often see you might have an issue with one hip and the opposite shoulder. That's quite common. So I want you now to think, can I lift my shoulder up again, but can I lift it up from my shoulder blade in back? And that's a different experience than lifting it maybe from the collarbone and then bring it back down. And we'll do that a few times. on one side. See if you can lift the shoulder blade up and then let it come back down. And lift that shoulder blade up and let it come back down. And then the other side will lift the shoulder blade up. So it's quite good if you're relaxed back in your chair, because your back won't be arching or as tight, and it should allow it to move a little bit freer, lifting it up and bringing it down. And again, that shoulder blade wants to come up. So a lot of times we get tight in the muscle that helps to lift the shoulder up, but often it's because we're holding tension below the shoulder blades and it's having to work too hard. So just be really aware when you're doing this that you're not gripping in your lower back, so holding tension there. So that's why I like to relax back on something as I do it and coming back. So that's very much in the direction of up and down. But we also have the direction of going around our ribs in one direction and the other direction. This is where people can get caught out, is that when you go to do something like take your arm open to the side, again, if my shoulder blades are out here, and I haven't let my shoulder blade come towards my spine as I open my arm, then I'm separating the joint from the shoulder blade again. So what we're going to do, and you can take a short limb, so it's often better if you have a bent elbow, especially if you haven't done this before, is I want you to think about trying to draw your shoulder blades together in back, and that automatically takes your arms open a little bit, and then let them come back. So I'm not taking my arms open, I'm taking my shoulder blades together, which takes my arms open. So it's a different experience. And then bring it back. And we'll do that one more time. So we take our shoulders open or together and back. And sometimes we get caught there, but I know a lot of people that are tight or held under their armpits, and they don't let their shoulder blades move together and back. And so when they do things like to put a shirt or a piece of clothing or a jacket on, they whip the arm back and it just pops out the front because actually you haven't moved the shoulder blade and back. So these are movements that are good to think about. And then we're going to do a little bit of the same, and I like to think about the spine on this because the shoulder blades also need to move that way. So we're going to think that we allow our spines to go back into a bit of a rounded spine, and that's going to bring the shoulder blades around the ribs that way, and then come back. And you may feel really tight here. And again, we're going to drop the spine back and get that feeling of the shoulder blades moving around the ribs. Good. And there. And coming back. So you might feel stretchy if you tend to hold there. A lot of people hold in the back of the ribs. So we're going to integrate now a shoulder roll. And we're going to think about all of those elements coming together. So I want you to think that both your collarbone and your shoulder blade kind of take your arm rather than your arm doing its own independent thing. So we're going to go forward. And we're going to go up, and the collarbone and the shoulder blade back and back are going to go up. And we're going to let it roll all the way back so we feel that the shoulder blade is coming towards our spine. And our spines will maybe move with this motion a little bit because no movement should be independent of another bit of your body. So we're going to roll the shoulder up and around and down and back. And again, and be careful not to jam it down. That's where we end up having a bit of problems, because when we jam it down, we generally pull our arm out the socket. And again, and just circling around and back. And we're going to do the other arm. And I always put my other hand on because it helps me know where I am in space, and it helps my brain know where I am and what we're moving. So we're going to go forward, and we're going to glide the shoulder blade up, and we're going to glide the shoulder blade in back and down, and we're going to glide it around and up and all the way back and down, and the ribs can move with the movement, and up and around and down and back. One last time, and we're going forward and up and around and down. And we're going to reverse that. So we're going to take the shoulder back, and we're going to bring it up, and we're going to let it come forward and down. And don't take anything into a place that's not comfortable, taking it back and up and around and forward and down. And my arm can be supported on my leg, so it's not just hanging in air. So I don't have as much to worry about in that way. And we're going to take the other side. I'm going to go back and up and around and down and take it back. So the aim is that we're moving that shoulder blade, the collarbone and the arm, and bringing it down. And again, take it back and up and around and down. And just relax if you want. Just rotate your head a little bit from side to side, because we are using a lot of the muscles that go up into the neck. If you're rotating from side to side, don't take it too far, especially if you're unstable. And you may find that it's difficult going one way and not the other. And don't force it, because if it doesn't want to move there, there will be a reason. And you never want to force movements. So whenever we do physiotherapy or whenever we do movements, if the body doesn't naturally want to go there, there will be a reason. Don't force it. That's where we do get into trouble. So we're going to look at breathing a little bit now, because our core can really be impacted by how we breathe, because all of your core muscles are part of your breathing mechanism. So coming down, I want you just again to relax. So our lungs are actually in the back of our bodies. And if you look at them expand, I think we are like fairies. I like to say this. We have like fairy wings. They open and back. They go whoosh out and back to the side and come back in. So we're going to use feedback against our back a little bit. But I want you to totally relax. So I don't want you to be arched up this way, or it will inhibit that movement in the back. So we're just going to think, and don't be frustrated if you feel like you can't do it. It doesn't matter. Any kind of breathing is going to be good for you. So we're going to think about opening and back and then relaxing. And the other thing we're going to think about is making our exhale longer than our inhale. So our fight or flight, which is our sympathetic nervous system, is stimulated by inhalation. So if we take a big, long inhalation, we're stimulating that part of our body. And as people with hypermobility, then that can not be the best place for us to be going. So the exhalation is where we stimulate the rest or digest, the parasympathetic. So homework for breathing would be to just slow the exhalation down, not to worry so much about how you breathe, but just to get that slowed down on the exhale. So we're going to stay there, and I want you to think that you have fairy wings in the back of your body, and as you inhale, those wings are going to open sideways. And then you're going to slowly exhale so that those wings can come back in nice and slowly. And again, you might get a little bit lightheaded, so make sure that you feel like you're in a safe, comfortable place. And that will just be blood flow and things. And again, so we can inhale through our noses if we can. Think you've got like little tubes going into the back of the body, and then slowly exhaling. So we know belly breathing is great because of the diaphragm, but sometimes as hypermobiles, we get super stiff in the back of the ribs, so it's quite nice to focus there. And again, you're just going to inhale into the back. Feel that your fairy wings open. And then slowly breathe out. If there's any men watching this, you don't have to have fairy wings. You can have beetle wings. And again, we're going to breathe in. And you're going to slowly breathe out. So I'm talking, but I want you to all be breathing out really slowly, so you can decide at home what the length and duration of your breath you're comfortable with, especially if you've had COVID or any issues with breathing, so you might not have as long a breath. We're just going to do one more, breathing in. And we're slowly going to breathe out. Good. Now what I want you to do is I want you to think that you've got something on the top of your head and you're going to grow tall, lifting it up to the ceiling, lengthening up through the spine, giving yourself space. And then I want you to go back to almost a slouchy position, which is where a lot of us like to hang out. And then we're going to go up again. We're going to lengthen through the spine, sitting nice and tall. And I want you to be aware of, did you grip your hips to get there? Because our hips do not stabilize our spines. So if you felt you had a grip in your thighs and your hips to sit upright, we need to find a way that your spine can hold itself up. So go back to relaxing. Make sure your thighs and your hips are totally relaxed. And now I want you to think that it's actually the bones of your spine that start to hold itself up, and you're going to start from the bottom, and you're going to think that you can almost feel like this might be really tiring if you're not used to this. But it shouldn't feel grippy. It should feel like you're giving yourself a bit of space and a bit of air. And I want you to feel like you can find that going all the way up through the spine, through the neck, to the top of the head. I'm not lifting my chin to get there. I'm not lifting my shoulders. My spine's having to hold me up. And I can hold it there as a little exercise, and then I can let it come back down. And we'll do that one more time, and we can lengthen right from, so a lot of times if people say, I know that a lot of times people are told to sit upright or have better posture. And the way that you go about it is to pull your shoulder blades together and back to try and open your chest. And that's not really what we want to do, because then that doesn't let our shoulder blades move nicely. So what we need to find is that way to lengthen right from the base of the spine, coming up without gripping our hips. And it might take practice. I've had 20 years of practice. So if it feels hard, don't be hard on yourself. Lengthening up and feeling like I've got space in between my ribs and my hips, and I've got space in my spine. And that's really my stabilizers. And now what we're going to do is we're going to take a band if you've got one. And if you don't have a band, please don't worry. And we're going to take the band behind your back, around your shoulder blades. And we're going to try and integrate a little bit of the lengthening of the spine up with just taking our arms forward. So if we think about our arms and all of our appendages, they need a stable base. So, you know, we were talking about the core, and we can concentrate on tummy muscles, but the core is much more than just abdominal muscles. So really all we need is for our spines not to wiggle and wobble when we try and move our arms and our limbs. It's not about gripping anywhere. So what I want you to do is I want you to be aware of your bodies again. So if I say lengthen up, have you really done that? Because that's not ideal either. So I'm shortening it back and lengthening in front. I want to feel like I'm lengthening in the front and the back of my body. And so I'm going to start to take my arms forward. I'm going to be pushing the band with my arms. So I'm actually using the band around the back of my shoulder blades as proprioception. Now, I don't want my shoulder blades to be pulled together, because if they do, my shoulder blade won't be going with my arm. So I almost want you to feel that you push from your shoulder blades, your arms forward. And then at the same time that I've got a length up through my spine. This may be super hard work. And then slowly come back, because the release of our muscles needs training as much as the contraction of our muscles. And again, so you're going to think that you almost allow your spine to be present into your band, and you're going to let your shoulder blades take your arms forward. And at the same time, you're going to keep that length through the head and neck. And then you're going to slowly come back. So if you don't have a band, that's absolutely fine. You're just going to straighten your arms without the band. And now, if your shoulders are super comfortable doing that, we're going to go one arm at a time. Then we're going to start to take the arm a little bit higher. And what I want you, we're going to do one arm at a time specifically, because I want you to be aware that as you take that arm, that you allow a teeny bit of rotation, and that you allow that shoulder blade to move with the arm, so that your arm has a socket. and then come all the way back down nice and slowly. If it doesn't feel safe going high, then keep it low. And because your body and your brain's movements may not be organized yet, and we retrain them. And we'll do the other arm. My shoulder blade is going to take my arm forward so that I've got it all working together. And then as I come back, I can feel that my shoulder blade is going to come back. It's not going to just stay there as my elbow bends. And you may feel like, oh, I can't feel my shoulder blade. I have no perception, no proprioception, no pins and then map. But just visualize in your head the shoulder blade taking the arm forward. And if you, like I said, if you can go up a little bit higher, then that's fine, and bring it back down. If you find you cannot lift your arm higher, it feels like it might subluxate or dissipate, I want you to try lifting your shoulder up a little bit, because a lot of times if we're really weak, our arms are hanging down. Everything is hanging off our bodies. A little lift, like if you had a cushion under your armpit, will allow you to take that arm up where you couldn't before. So you can almost feel like you have a little tiny lift of the shoulder to take it up. Now, I want you to think when you do this that your elbow stays forward and doesn't go out to the side. So try and keep the elbow forward as you lift up. As you come up, so my armpit's almost facing front, not out to the side. If my armpit's facing out to the side, my shoulder blade isn't coming with me. And come back. And again, the other side, so my armpit wants to almost be facing forwards, not open to the side. And coming up. And that will maybe make that movement feel smoother. And we'll just do one more on each side. Taking it up. So my armpit is facing that way. And coming back. And the last one. And reaching. And coming back. And now we're just going to do a little bit of rotation. So we're going to take our arms down low again. And we're going to rotate to one side, and we're going to think about the ribs and the shoulder blades, but we're also going to think about our sternum bone, this bone in the front. So when we rotate, our spine rotates, our ribs go with us, but our ribs attach in the front here. And a lot of people can get something called costochondritis. And people aren't aware that this bone actually can rotate with us. So I want you to imagine that your sternal bone has two little eyeballs on it. And whichever direction you're rotating towards, I want your little eyes on your sternum to look in that direction. So I'm going to use an arm with the band to help me, because I like that in my own body. It gives me a sensation of what's going on in back. So I'm going to rotate that way, and I'm going to take this arm. So my ribs are going to take me around, and I'm going to think that my eyeballs are looking that way, and only go to where you're comfortable. You don't have to straighten your arm. It's just a guide to guide your ribs around and come back. And then we're going to go the other way. So my eyeballs of my sternum are going to look in the direction I want to go. And I'm just using the band to help guide my ribs around too. And coming back. And then there's one more thing we can think about, which is the arm that's not going forward. So my sternal bone's looking that way. The arm going forward, my shoulder blade's going around that way, but my other shoulder blade needs to be able to go towards my spine again to complete allowing those ribs to move without being pulled. So we can get subluxations of the ribs when all of these bones don't move again. And we're going to go the other way. The sternal bone moves, the arm comes forward with the shoulder blade, the other shoulder blade is going to be allowed to glide back and coming back. And we're just going to let the band go. And I want you just to come forward and just allow your spine to stretch, sagging forward, and then rolling back up. Again, only go to where you're comfortable. And again, you can slide your hands on your thighs and just open up the back a little bit and come back up. If your neck's not happy, then obviously you could just be watching this. One more time, just a gentle slide forward. Maybe we'll take a breath into our back on this one. Breathe out and coming back up and relax. Well done. Right. What I want to do now is we're not going to leave the hips out, but I feel like the hips are better dealt with. either lying down where we can open them a little bit, but we're going to think about our feet now a little bit. So I'm going to take my socks off so you can see my feet a little bit better. So like everything else, we have lots of bones that move together and work together, and we're just going to start. So a lot of us, I want you to make sure your knees are bent and your feet are not out in front of you that way. So when we do, if you have hyperextended knees, which we don't all have, it can alter things at the feet. So we want to think about keeping our knees bent, and then we can take that out of the equation completely. Many of us, our feet roll in. So in relation to your hips, when your ankles roll in, your lower leg bones roll in, it takes your upper leg bones in, and it puts your hips at risk of subluxation if you're prone to that. What I would say though is be careful not to think that your feet can generally fix your hips, because I have seen clients where actually the driver of the rotation of the hip comes from above, not below. And when they correct the foot, they cause another torsion in the leg, and then they end up with another problem. So what I would say is I want you to explore hands on your thighs for me now. And we're going to roll your legs in and out. And I want you to see if your thighs respond. So if they don't respond from your feet moving, then you know that the feet are not causing any rotations up the chain, that things up the chain will be causing more or impacting you more. So we're going to start with rolling. Let's take one foot. We're going to explore rolling one foot in. So I'm going to take my right foot in, and as I do, it's not easy to sense motion too much. So if you have your hand more towards the outside of the leg, it's a little bit easier there to identify. If I roll my foot in, I can almost feel something tighten a little bit there or come out. And then when I roll my foot out, I can feel it almost travels in that way. So it softens a little muscle back there, and I can roll my foot out in, and I can roll my foot out, and I just feel a change. Yeah, it doesn't feel static. I feel a change. I'm going to go to the other foot, and I'm going to roll my foot in, and this foot doesn't move so well because I've had 2 surgeries on it, and I'm going to move it out. And I'm going to move it in, and maybe you're like I am, where actually you feel like your foot won't move in a direction particularly well. And then moving out and moving in, so I can move it out, but I can't move it in very well from the ankle. And coming out and coming in. Right, so when we stand for balance and we do our exercises, we want to be thinking about having a little bit more weight towards the outside, because your heel bone lines up with your 4th and 5th toe. So I want you to keep your big toes on the ground and connected, and I want you to very gently think, can I keep my big toe down and connected and roll my feet out onto the 4th and 5th toe, where I'm then going to be sitting a little bit out, tiny bit outside the center of our heel. And we're just going to stay there and hold that, and we're going to lift our heel up. And we're going to try and keep that alignment. So I'm not going to let my ankle roll right out. I'm going to think about weight through my 2nd toe. And then when I bring my foot back down, I'm going to try not to let it roll back in. I'm going to try and bring it back down. So I've got the weight across the ball of the foot. And when my heel lands, it's going to be slightly towards the 2nd toe. And we're just going to lift the heel up, trying to keep that alignment as we do. And then bring that foot back down. And we'll alternate feet. And this is a nice way to very slowly start to strengthen the foot and bring it down. Good. And coming up and bringing it down. And so we know that if you've got POTS or you've got anything else, then it's really good to get things moving in the lower leg and to get them nice and strong. Sometimes we can feel like our lower legs are super tight though. So one of the reasons for that is if you have got real laxity underneath your feet, your heel bone can get pushed out the back, and you lose the anchor for the back of your leg. So What I'm going to get us to do now is we're going to place our foot slightly forward. And it's hard for me to describe this, especially if you're not used to doing much with your feet. So like with my heel bones, they'll stick out the back and I have quite a lot of movement. I want you to gently draw back into your heel, which is going to make your hamstring work. And you're going to feel it in the knee maybe, but what I want to do, if you look at my foot, is I want the sensation that my heel is coming towards my toes. So I'm going to actively try and bring my heel towards my toes. And you can see what happens is it's creating an arch in my foot. So I'm pushing down a little bit to help, but not too much. But I'm going to try and bring my heel bone towards my toes underneath. And that's a lot of times we're told to pick up pencils with our toes and things like that. But in actual fact, a lot of people with hypermobility issues, it's the back of the foot where the weakness and the problem is. So this is a way to try and do a little exercise to bring that heel forward and to lift those bones that want to collapse on us. Because what we don't want to do is end up over gripping with our toes either. So we're going to bring that heel underneath us and the foot back and relax. And we'll do one more on that foot. And we're going to draw back. And actually that, for my feet, that feels very nice. And we'll go to the other side. This is my less great foot. So we'll see how that one is. So let's try and get an angle there. So I've got my heel on the ground. I'm going to very gently pull back. And I'm going to try and pull my heel to come towards my toes. Now, I'm not going to lift my toes to do it and relax. That might be a strategy. And so it's a feeling of, I'm almost feeling like I'm pulling my ankle back towards me to allow my heel to feel like it comes towards my toes underneath and relax. You can see on this foot, I get quite a big change when I do that in terms of I'm creating an instep underneath the foot. And then relax. And again, that heel comes underneath and towards the toes. And I can really feel like I'm working lots of muscles as well there. And again, drawing the heel, trying to draw that heel underneath. And again, if you feel like, oh, I have no idea how to do this, don't worry about it. Experiment through the week. Because sometimes it can take a really long time, or you can even kind of take your hand and think, I'm going to push it underneath and see how that feels to find that. And coming back, and this is the last one, and we're going to draw that heel back and the heel underneath and relax. Right. So what I'm going to do now is I'm going to lie down to do a bit more exercises. So if you can't lie down, then you can do some of the little pelvic tilts and the exercises we're doing there. And if we go into a bridge or something like that, what I want you to do is think about trying to push your feet down into the ground to stimulate muscle activation and things like that. So you can have most of the arms or anything else you can do easily sitting up. So I'm going to move the chair away now. And I'm going to lie down. I'm going to keep my band with me. So again, you can do these things sitting in a chair. I'm just going to bring this a little bit more forward so you can see a little bit better. Hopefully that's good. Everybody see me okay there? Perfect. So we're going to lie on our backs. Make sure if you're lying down that you've got something underneath your head to support your neck so that you feel really comfortable. So again, if you can't bring your leg up, if you're sitting, then just push it down into the ground for me, all right? So if you can hold your leg, that's great. And if you can't, that's fine. We're going to straighten the bottom leg if you're lying down. And you're going to bring this leg up to where your hip is comfortable. It should feel an easy movement. And you're going to very gently push away. So this is, again, is a really light push. So if you're pushing your foot into the ground, it's, again, if I was going to touch my eyeball and push, how hard would that be? Not very. So we're just pushing away a tiny bit. And then you're going to relax. And you're going to do the same thing. You're going to push away just very gently. And relax. And one more time, you're going to push away very gently. And relax. Bring that leg down. And we're going to change legs. So if you're sitting and pushing down, you're going to do it with the other leg. You're going to hold it there. And this is very light, very gently pushing. And relax. And again, very gently pushing away. And relax. And one more time, very gently pushing away. And relax. We're going to bend that knee back up and we're going to bring this one back down. And so we're going to very gently take our knees from side to side. So if you're sitting, just do a little rocking motion. And I want you to think that you allow your hips to move with the rocking motion. We can do that lying down. So you almost feel, you know, if you're lying, you're rocking over your sacrum or that little bone in the back of your body, just slightly. And what I want you to do is be aware. So this is a bit harder if you're sitting, but for the people lying down, if you take your knees to one side, I want you to let your foot come off the ground so that your knees don't slide. So if my knees slide, I'm overstretching my hip. I don't want you to feel like you're stretching there so much. You'll stretch a little bit, but I want you to feel like your hip comes off the ground. And you're only going to where you feel 100% comfortable, and then bring everything back. And then we're going to go the other way and do the same thing. You're going to start to lift that foot and you're going to take it to one side. And you're going to come back. So I am very aware that I can move easier to the left than the right. So generally speaking, the side that is harder to go towards is because the way that our pelvis moves and is set up is that it should move that way. As we take our knees to the right, that side falls back and the other side goes forward, and vice versa. So I want you to think, those of you who have sciatica, is when I take my knees to one side, the side that it's harder to go towards, is that the side that you have the sciatica in, or is it the other side? And it might be harder because you get a bigger stretch on the sciatic side, because you'll get information as to whether your sciatica, which usually indicates some form of compression of a nerve, whether it's being compressed because the bone is sitting back and it gaps and it can allow your disc to impinge on the nerve, or if it sits forward. So it can also be scrunched up because it sits forward. So if let's just use, for example, if my right leg, I have sciatica in that leg, and I go to the right, and I'm stiffer moving that way, then it's quite likely you need to open up your spine and back to help your sciatica. If it's the opposite though, if say my top leg is this leg is my sciatic leg and I'm going that way, and it's more difficult, it's more likely that that might be relating, possibly, not always, to a disc issue, of which you then want, you don't want to be over flexing, which is tucking under. So what I would say is that in either occasion, doesn't matter. If I find it's more difficult, which I did, to go to the right, I'm going to take that leg again and I'm going to hold it. This time I'm going to push harder. So I'm almost trying to mobilize my bones back a little bit. So I'm going to take that leg and I'm going to really push. Push, 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 push. And then I'm going to relax. And I'm going to do the same thing again. I'm going to really push. And I'm going to relax. Now I'm going to bring my legs back together. And I'm going to see if it makes it easier to take it that way. The other thing I'm going to do is make sure I'm not holding tension under my armpit on the opposite side. So as I take my knees, I'm going to make sure I don't hold that shoulder. And now I can move much easier and come back. So that's a little thing that you can do as a nice exercise if you've got sciatica, so you can think about that. And then the other thing we're going to go on to now is some bridges and some little pelvic tilts. And I want you to put your hands on your hip bones, everybody. So you've got bony bits here. And as we start to do a very gentle pelvic tilt, and it doesn't matter if you're sitting or lying down, I want you to be aware, does one side move back before the other? So little rocking of the hips. And you want those hip bones to move evenly. So if one starts to move before the other, the one that does not move, put more weight in that foot. And then try and get them so that they move together, so that you've got the gapping in back even on both sides of your spine, which will make your back happier. And you're less likely to impinge on any nerves if you can get them to move nice and evenly, just in that little rocking motion of a pelvic tilt. Little rocking motion, and release. And again, little rocking motion, and release. Now, if you've got a band, I want you to tie it around your knees. We're just gonna take that around. And we're gonna do the same thing. We're gonna add that rocking motion on with a little bit of feedback into the band. And this is really good if you've got unstable hips. So you want to be moving nice and evenly. So I use this a lot, this exercise, rather than a clown, because it's not always obvious with an unstable hip which is the weaker side. So this does both. So we're going to start to take those knees open, and we're going to pelvic tilt. So the knees open goes with tucking the tailbone under and release. Now, if you've got sciatica, think about it, what we just did before. And the side that it was harder to take your knees towards, if you could tell, put more weight through that foot. And that will start to make you move a little bit more evenly. Now I'm going to go all the way up into a bridge. So we're going to start to take those knees open. You're going to roll through the spine, and you're going to start to come into a mini bridge, lengthening out through the thighs. And from there, I'm going to roll back down one bone at a time. And I always have my hands on my hip bones or on my body for proprioceptive help to know where I am in space. And I'm going to relax all the way down and then let those knees go back together. And again, take those knees open, little pelvic tilt. I've got a bit more weight through the foot of the side that I know I don't go towards as well, and that helps my bones move back. And it may create a different kind of stretch in my back, but it takes any discomfort away. And rolling back down nice and slowly, all the way to a neutral spine, letting those knees come back together. And I'm going to make sure when I do this that I'm not gripping my belly and pulling myself from my abdominals. They should be super relaxed. And I want this to be that you're moving your spine and that your legs are doing the work. Good. And then slowly roll back down. All the way back down, relaxing. And those of you who are on your back can just slide both your feet in, and we're going to take the band off and put it to the side. So we're going to do something now that we traditionally do in Pilates, which is called a knee float. And you can do a little fold and lift if you're sitting, but do know that your legs will have to work much harder because of gravity. So maybe do less is more. Because you will be working harder. So I want you to put your hands on your tummies to begin with. So what we don't want to do is get overly grippy. That isn't really what core strength is about. Core strength is about having enough stability to deal with the forces applied. So if I'm lifting a leg, I just need enough where I'm not going to move around too much to let my leg come up. If I grip my leg, I create more force I need to grip everything more. So the idea is that we're going to learn to fold the hip so that we don't need to grip anything so much. So we're going to keep the foot coming towards our bottom as we fold that leg in the air. So I want you to start with a nice breath in through your nose and relaxing everything. And then as you breathe out, I want you to slowly let the exhale happen. And as you're exhaling, you're going to slide your foot to your bum and you're just going to fold your hip. And that's just going to be stage one. And then we're just going to let that leg come back down. So when you lift that leg, I want you to continue your exhalation. So you're going to inhale through your nose because I don't want you holding your breath. And as you exhale, you're going to slide your foot to your bottom and you're just going to let that hip be as relaxed as possible to fold it in the air. And then you're going to bring it back down. And then I'm just going to ask you to take your hands on your tummy. And what we're going to do is, so we don't want to, traditionally in Pilates, you can get different cues that I think can be confusing to people. So what I want you to feel is that you are able to hug your organs with your abdominals. So if you put your hands on your tummy, it's not going to go super rigid. It's not going to be hollowed out where your ribs flare out or anything like that, but you feel like you can contain your organs. So you're just going to feel like you're hugging your organs, your intestines and all of that, and then relax. So it shouldn't be overly grippy. So we're going to apply this to lifting our leg now. So you're going to inhale through your nose. And you're going to exhale and you're going to hug your organs. And I want you to feel like when you hug your organs, it's not just up here, it's not just down there, but the whole lot is being hugged. And then you let that hip fold. And then once you're there, you let it go, let it hang out and inhale. We don't want to be holding anything on our inhalation. And you're going to find that hugging of your organs and you're going to slowly exhale. And as you exhale, the leg comes down and you are holding the organs and then you let it go. And we'll do the same on the other leg. So inhale through your nose. Exhale, hug your organs. Bringing that leg up. Now, have you tensed your shoulder, your neck, or your jaw? If you have, let it all relax again. Inhale through your nose. Hug your organs. Keep breathing out. Don't hold your breath. Keep exhaling, keep exhaling, keep exhaling, keep exhaling. When you get your foot on the ground, make sure your thighs and your hips relax. If you find this difficult and grippy in here, then take your legs and feel like you pull the tissue out sideways. So you can do that with the heel of the hands or with your fingers. So we'll do one more. Maybe we'll all do that. So we get that feeling that we're not over gripping just here. Inhale through your nose. Exhaling the air out, the leg comes up. I like to use the thumbs gently, but I'm not a real subluxer of my thumbs, so it could be difficult for you if you are. And you're going to just bring that leg up, folding at the hip, with a bit of hugging of the organ. Take a breath in. And it's it's not grippy, it's a gentle holding your organs in place. That's what you want it to feel like. And then let it go. And you might feel it around your back because the muscle that we're working does work like a belt all the way around to your spine. Take a breath in again. Exhale to feel like you just hold your organs in place as you lift your leg up. Good. Take a breath in. So you can practice this at home, and if it gets super easy, you can start to take the second leg in the air. We're not going to do that today. And everybody just relax. Right. What I'd like to do now is we're just going to briefly do something on our tummy and then on all fours, and then we'll finish. So I want to get us lying face down. Again, if you can't, then just watch. And you can do the upper body part of this. You don't have to do the legs. And I'm going to start
face down. I want my forehead is on here so that I'm looking straight down. My head isn't broken, my chin's not on the floor. And I'm just gonna, or you can relax your forehead on your hands if your shoulders are comfortable. We're just gonna start by bending the knee to begin with. And I'm gonna push my knee into the ground lightly. And then I'm gonna relax. And I'm gonna do the same thing again. I'm gonna push my knee into the ground very lightly. And then I'm gonna relax. And I'm going to push it lightly down and relax. And I'm going to change legs. Other side, I'm pushing it lightly into the ground and relax. And again, pushing down and relax. One more time. You might need a cushion under your belly if you feel like your back is really arching or it's uncomfortable, and relax and bring that leg down. Now, all I want you to do is reach your legs, reach, reach, reach. When you reach, I want you to feel like you're reaching from here. So this is almost going to stimulate opening the front of the hips and getting your gluteals working. I want you to reach, reach, reach. You might need cushioning if you feel uncomfortable, and then let it all relax. And you're just going to reach from your hips. I'm reaching my legs to the wall behind me for my hips. I'm keeping my shoulders relaxed. And relax. And now what I want you to do is I want you to think that the bones that you sit on, you're narrowing them. So you can do this if you're sitting. You've got two bones you sit on. You're going to reach. So even if your hips are flexed, you can think of narrowing the bones you sit on. I'm going to narrow the bones I sit on as I reach, which helps to bring the hips into the socket. And then relax. So this is going to be one more time where I reach and I narrow my sit bones. I'm not tucking under. That's not narrowing the sit bones. That's moving the spine. So it's like you've got a clamp and you're clamping it together there and then reaching. So different from tucking under. So when I tuck under, I feel my abdominals all tighten and are uncomfortable. My abdominals are not working at all. I'm not getting my ribs being dragged down. I'm just narrowing from there. Again, this could take practice. And relax. Now we're going to add a little shoulders in. So the arms are going to be down by your sides. And you can do this sitting up. And the aim is that we bring the shoulder blade towards the spine so that I open that shoulder and then I let it come back down. If you have super hyperextended elbows, try to soften the elbow. Draw the shoulder blade toward your spine, opening up, and then let it relax. We'll do the same thing on the other side. And I'm going to draw that shoulder blade towards my spine, opening across the collarbones. Make sure that head is supported and your neck, and come back down. One more time. And draw that shoulder blade towards your spine and come down. And the last one is going to be both of them together. And for those of you who are feeling comfortable and you really want to go for it, we're going to add this bit onto this bit into what we call a dart. So I'm going to get both shoulders coming back and open, and I'm going to narrow my sit bones and reach my legs. And I can just hover my arms, and the whole back of my body is having to work. And relax. Well done. So now we're going to come on to all fours, and you can do the arms and you can do the spinal positions in seated. You can be on your elbow if you don't trust or want to be on your wrists or your hands, or you can come onto your hands, bringing them forward, as I've said, if you've done my classes before, so that you don't have too much pressure through your wrist. Take it forward. And I'm watching that I'm not spinning my elbows around, so the crease of my elbow isn't facing forward, it's facing diagonally in front of me. So I'm not rolled in and I'm not rolled out. I'm in a neutral position with my shoulders. So I'm just gonna think about, you can almost think, if your head wants to sag there, that you lift that neck up to support it. Watch that you're not tucked under. So I want you to relax your bottom completely. You might feel like a duck there, and I don't want it to be hanging and I don't want it to be tucked. So you're thinking about having a very neutral spine. And from there, you're just going to think about reaching. So even if you're in air or sitting, you're reaching those arms down and forward. So you're reaching out and forward if you're sitting. And that's going to bring me stability in my upper shoulders, or you can have your hands on the wall and standing, and then just relax. So practice that sense of drawing into the ground with a slight amount of pressure towards the outside of the hand and forward. And then we're just going to go into a cat stretch. So you're going to bring your spine up to the ceiling, or if you're in a chair, towards your chair, or if you're standing, you're doing the same, pushing and just letting your spine curve. And then you're going to allow your spine to come back to neutral with your shoulders relaxing away from your ears. But I still have that downward pushing down and forward because I'm trying to work my shoulder stabilizers. And now I'm going to let my spine sag to a comfortable place. And that's by letting my sit bones widen. So we narrowed them. Now they widen. My spine can go into an arched back or sagging extension, and let your shoulder blades come together and feel, some of you might feel tight in your bellies. If it's uncomfortable to go there, don't go there. So we all have different spines and different issues. And again, we're going to go up, let your head drop down. You're going to push down and forward into the ground, and you can rock back a little bit if you're on your knees. And open up the spine. And come forward. And gently releasing the spine and just get it moving the other way. Keep it simple and keep it small. If you feel it's uncomfortable going into a range, then don't go there. Just go where your spine is super comfortable. And we're going to do one more time, lifting up and rocking back. Come forward. And gently release out of it and relax. If you've been on your wrists, shake your wrists out. Good. Now I want everybody to find a position that they're super comfortable in, and we're just going to relax for the rest of this session. So whether you're lying on your back or in your chair or wherever you are, I want you to find yourself, prop your legs up, prop your head up, wherever you are most comfortable. And we're going to start thinking about your toes and your feet. I want you to take a nice deep breath in. And then I want you to slowly exhale. And as you exhale, I want you to focus your attention on your feet. And I want you to try and let all the tension in your feet go. So as we breathe out and we start to focus on the body, I want you to feel like the tension goes away with the exhalation. So moving up through the feet to the ankles and your lower legs, I want you to inhale. And again, slowly exhaling. And I want you to feel that wherever you are, that your body is supported and that you can let the tension go. So feel that your lower legs are almost hanging off the bones. You're not doing anything where you need to use them right now, and just let them go. And you're going to continue breathing in and exhaling. And as you exhale, I want you to let the tension in the hips go. So you're not holding on to any of the muscles in your buttocks or the front of the hips. And continuing to breathe at your own pace, inhaling and exhaling, and being aware of where you might be holding your tension. Because we always find there are places that we all rely on for extra help, and those tend to feel a little bit tighter and a little bit more tense. Be aware of the pelvic floor and the lower belly, and around your buttocks and your lower back, and take a breath in through your nose. And as you exhale, feel almost like you're washing away the tension from that lower, from the hips all the way down.
through the legs and out through the feet. And we're moving to your abdominals, your belly, and your spine and back. And again, you're going to inhale through your nose. Taking your time as you exhale to really sense whether or not you're holding tension. You might not even know that you're holding tension. So I want you to actively try and feel like you can relax muscles into the ground or onto your chair. And let's move up the spine, either side of the spine. We have muscles that come and attach right from your pelvis all the way up into every single rib, all the way up into your neck. So we want you to actively try and relax all the muscles running up the side of the spine as you breathe out. Let's think about the front of the chest. And again, so inhaling, feeling you're not holding tension in your chest or around your ribs. Slowly letting the air come out and just feeling like the muscles relax as you exhale. All across the shoulders, the top of the shoulders, around your armpits, under your armpits. Breathing in and exhaling, letting all of that relax now. Think about your arms, your upper arms, into your elbows and your forearms, and your wrists, and some fingertips. And on your next exhalation, you can just feel like all the tension is running out your fingertips. Letting go of all that tension. Now let's think about our necks now into the back of our head. So at the base of the skull, into the jaw, and the base of underneath your ears. I want you to really feel that you have no tension or gripping through that area. Be aware of whether you've got gripping on one side as opposed to the other. And again, just use that exhalation to try and let it go. And think about your jaw up into the side of your face, your cheeks, your temples, all the way across the forehead, in between your eyes and across the bridge of your nose. I want you to actively relax your facial muscles. We can even think of relaxing our lips, our tongue, our ears, every bit of us. And I just want you to continue to take a few more breaths in and out. Slowing it down, feeling like your body is completely relaxed from head to toe. Making this your last breath in and out. And what we're going to do is very gently roll to your side and sit up. And then I want you to take your time, especially if you've got POTS. And you can gently open your eyes, let everything organize itself again. Allow yourself to enjoy feeling calm. We don't often get calm in our lives. Well done, everybody. Thank you for watching and staying tuned. Right, so that was the end of this class today. I hope you enjoyed it. If you did, then subscribe and let me know in the comments things that worked for you, things you found interesting, or things that you found difficult as well. So it's Bonnie Southgate, hEDS Rehab here. Have a fantastic day.